teachers' unions say that they're eagerly waiting for the 300,000 COVID-19 vaccines promised by Aspen Pharmacare to arrive, but we're worried about the quantity being earmarked for South Africa's teachers. Well, let's discuss this further. The National Professional Teachers Organization of South Africa, or also known as NAPTOSA, the executive director there is Basil Manuel. Mr. Manuel, good evening to you. In the last couple of weeks that we've been having the conversation around teachers, it has centered on vaccinations, but also the plan by the Department of Basic Education to have schools resume, at least at the primary level, on a more full-time basis. Talk to me about how that conversation is shifting, if at all, in the wake of these increasing COVID-19 numbers.
At first, let me say that we're very happy that we're getting some of the vaccines. We'll talk about that later. Insofar as the debate is going with the rise in COVID numbers, etc., NAPTOSA has always been firm, and I think the other teacher unions have said the same. Let's hear what the science says, and let's hear what our other education experts say. The science is saying to us at the moment that we're not at the peak, and it would be more advisable to close schools if we get to a peak. But to summarily close schools without a plan is also not a plan. And NAPTOSA certainly at this stage is saying we are still watching the situation, we are still listening to the experts, and certainly when we believe that we are at the point where we need to be making that call, we will make the call. And remember, it's not about closing schools, and it's possibly, in NAPTOSA's view, about shifting when the holidays will be, so that it coincides with the peak, so that it doesn't happen, the holidays aren't there after the peak or before the peak. And that becomes critical for us because losing more teaching time becomes extremely difficult, and learning time. We know what losses we've suffered, we know how difficult catch-up is going to be, and we are part of the conversation. Our last conversation was just a few days ago. And of course, but as you're saying, things are changing daily. So daily we are looking at this, and certainly we are worried, not only about the numbers, but also the mental health of teachers, because the numbers generate other concerns, and that is also where our concerns lie.
Mr. Manuel, this is where things become a bit complex to manage. The NICD has said that technically South Africa has already entered the third wave of this pandemic. Depending on which province you are in, we are effectively 4 out of the 9 provinces already seeing high levels of the third wave. So in terms of a nuanced approach, given where the greatest impact of this pandemic is being felt, would it be justified, in your view, for some provinces to shut schools at this point?
Let me say that we've always had a staggered approach, and even our calendars have had a staggered approach. So if we get to the point where some provinces have to close schools and others not, there will be no problem with that, because that is what we've always done, as I've said. And however, we've got to make the decision based on the context at that moment. And as you say, the interior provinces seem to be at a different place to the coastal provinces. And that has been exactly how the calendar has been managed over the years. And we are looking at that as well.
Let's talk then about the plans by the Basic Education Department for at least the month of June for full-time, continuation of school at a primary level. At this point, is that still the way to go as far as you're concerned?
Well, a couple of facts. First of all, it's about primary school children and their infectiousness and how and whether they get infected as easily. And of course, we know the science is telling us that that doesn't happen. However, the fears are still there. And we've supported that move. We've given qualified support. We've said we'll watch the signs of the times as well. And then given that now we have a certain number of vaccine doses arriving, that does make the anxiety a little less intense. And that certainly attends to our teachers that have comorbidities. So July is still a while off. The end of the month, 26th of July, and we are watching it. But nothing in COVID we've been taught is cast in stone. Today, it looks like bright sunshine, and tomorrow it looks like thunderstorms. So we're going to watch the signs of the times, and we've said that to the ministry, and we still believe that primary school children going back, the principle is the correct one, simply because we've lost out so much, particularly with our junior primary children. We've got to find a method to catch up. Otherwise, we're planning for a lost generation, which we can't be part of. So when we get closer to the time, we'll be reviewing as well. But the principle we certainly support.
Let's talk about the issue then of vaccines and teachers being vaccinated. At this point, when you look at the uptake of vaccines by teachers, has it been taking place at a satisfactory level? Of course, I know there's also the issue of availability of vaccines.
Yes. Well, two things come to mind. First of all, the teacher union collective. Those 5 teacher unions, ourselves and SATU and SAOU and PU and NATU, we did a joint survey with Professor Metcalf. And our joint survey ended last week, at the beginning of the week. And it dramatically changed results from a previous survey, which the collective had done. 75%, actually 74% of the people surveyed said, yes, they will gladly take the vaccine tomorrow if it arrives. Of the 26% that didn't, 15% were saying, we undecided. Now, given, let's say 5% of them fall on the side of taking the vaccine, we are talking about a massive 80% positivity, which is greatly encouraging. Of course, the hiccup with the J&J vaccine has probably tainted some of that a little, but we are going out there and we are saying to membership, we are saying to teachers at large, we are saying to education workers, here's a golden opportunity. You've been moved to the front of the queue. Embrace it with everything you have. And, of course, we will continue agitating to get more vaccines to cover those that may not be covered in this round.
What are you finding are the greatest concerns that teachers have about getting vaccinated?
Well, from that very survey that I make reference to, one of the biggest concerns was that people don't know enough about the vaccines themselves. Whilst there have been broad stroke reports on efficacy, etc., and I think it was early in the day, and it referred to vaccines that they aren't necessarily seeing. So that was one of them. And, of course, social media has also penetrated the minds of so many, where we have so much information and bad information as well. And people have read this. And so the concerns very often lie in things that don't exist. But those have been raised too. And then, of course, people have raised issues such as, what about the under 40s that have comorbidities? And what about me getting the vaccine, but my partner at home is not getting the vaccine? And there are things like that that came to the fore. But by and large, people indicated that they understood what the vaccine was about. They understand vaccines. They've all been vaccinated in their lives before. But we have an element that is still saying, not for me, I'm not going down this road. And those are the people we are working with.
One of the things that we're actually getting to learn through this disease is that trust is a very, very important factor when it comes to the relationship, whether it's between, teachers and the government or teachers in the health sector, etc. Do you feel that there is a greater level of trust in the system, in that teachers are supported now, better supported to protect themselves against the virus than they were perhaps where we were last time this year? And especially for those schools that don't have access to a great deal of resources, because that's where the problems really lie.
A couple of things. First of all, one of the questions we asked in the survey was, where do you get most of your information from, and whose information do you trust the most? And coming out quite high, very high, right at the top, was the Department of Health, which is really, really positive. And the second was my teacher union. And way down the line were some of the other entities that you'd expect teachers to trust. Now, this is important, and this is where we stand. We stand there for the membership, and we speak what they can't say to the public. Then, to go further, we have found out that the concerns about places like overcrowded schools, even today, when we had the teacher appreciation and the June the 16th webinar that the minister hosted, I looked at the chat and I saw a lot of people asking those questions about overcrowded schools. How am I going to do social distancing? Can we not get additional classrooms? So they are positively asking these things, not saying, I don't want to go back. They're saying, yes, things have changed a lot. We are getting the PPEs. Our provinces are actually starting to deliver these things on time, but now we are worried about the number. Will they be able to deliver in the quantity that is required now that all the primary school children come back? And that is extremely heartening, because people are showing what real teachers are about. Real teachers are about their children, and they are always showing that. But we mustn't forget that they are human beings as well, and we need to take care of them.
Basil Manuel, let's leave it there for tonight. Basil Manuel is with the union NAPTOSA.